ensures privacy, does hand hygiene, puts on gloves. Hello, my name is Taylor. I'll be your nurse this afternoon. Can I go ahead and get your name and date of birth, please?
Sir Lewis Hamilton, June 2nd, 1998.
Okay, Mr. Hamilton, your doctor has ordered that we do a head-to-toe assessment on you. Is that okay?
Mm-hmm.
Okay, before I really get started, I just want to make sure that your hair is evenly distributed. I don't see any lesions or any abrasions. Do you have any history with like scalp issues, dry scalp or anything? Okay, have you had any recent head trauma? Okay, I'm gonna palpate the head. I don't feel any abrasions or lesions. Your head seems to be normal cephalic. Do you have any ear problems, like drainage issues or anything?
They just get clogged really fast.
Okay, so look at your ears. They're normal for your head size. The top of your ear auricle lines up with your eye canthus. And the way I know that is because drawing an imaginary line from top of your ear to the end of your eye, it's straight, so it's good. Do you have any like eye issues, like do you wear glasses, contacts, or anything?
Glasses and contacts.
Okay, so I'm going to perform a Perla assessment on you, and Perla means that your pupils are equal, round, and they react to light and accommodate. So what I'm going to do is shine this light in your eye, and I'm just going to make sure that it constricts. It should constrict in the eye that I'm shining it in, and then the other side should 50% constrict, and vice versa. I'm just going to do this. Measure your pupils. They're 4 millimeters. Okay, and now I'm going to shine the light. Okay. Okay. Your eyes constricted in the light that I put them in, 50% constricted in the opposite eye. And I'm going to do the A1, which is accommodate. So can you look at my badge and then look at the TV, but only moving your eyes? So look at the badge, TV, badge, TV. Okay, so they accommodate. Do you have any problems with your nose? Does it, get clogged, any drainage or any issues?
Just bad allergy.
Okay.
So.
Can you put one finger over your ear and breathe out? Nose, sorry. And then the other side? Did that cause you any problems? Okay, so I'm gonna need you to open your mouth so I have to look at your oral mucosa. Okay, it's pink, moist. I don't see any tooth decay or anything. Okay, so I'm gonna hand you this imaginary cup of water, and don't swallow until I instruct you to. And when you swallow, I'm gonna put my hand on your trachea to make sure it's midline and you have no risk of aspiration or anything. So you can go ahead and swallow. Okay, trachea is midline. I don't see any reason for why you would aspirate or anything. And while I'm already up in your head, can you turn your head that way? And then the other way? Okay, no JVD noted. And just want to note that your carotid pulses are right here. You can turn your head back, or right here. And then I want to go ahead and do my respiratory assessment, which is just going to listen to your lung sounds. Do you have any chest pain or
asthma?
Okay. So what I'm going to do is start at the right upper lobe. Can you breathe in? Breathe out. Do the same. Breathe in. Breathe out. Go into the left lower lobe. Breathe in. Breathe out. And then go into the right lower lobe. Breathe in. Breathe out. And then moving laterally on the right side, so it's to the right middle lobe. Breathe in. Breathe out. And then moving laterally to the left side, till it's to the left lower lobe. Breathe in. Breathe out. Okay, I didn't hear any adventitious sounds. There were clear vesicular sounds. So now we'll listen posteriorly. Listen to the right upper lobe. Breathe in. Breathe out. Listen to the right lower lobe. Breathe in. Breathe out. Then going over to the left lower lobe. Breathe in. Breathe out. And then going to the left upper lobe. Breathe in. Breathe out. Okay? So both sides of your abdominal, anteriorly, posteriorly, I heard clear vesicular sounds and no adventitious sounds or anything. I'm gonna go ahead, let's see your fingers. Just want to check for capillary refill, and they both came back less than 3 seconds, so that's good circulation and blood flow. So I want to note that your axillary pulses are underneath your armpit, the brachial pulse is in the crease of your elbow, and then the radial pulse is right here. It's where your thumb lines up with your thumb a little bit. Okay, so while I'm already up at the upper extremities, I want to go ahead and check for edema. No edema noted. No edema noted in both upper extremities. And do you have any problems with your joints? Any problem moving any of your joints? Any pain anywhere?
In my arm, I can't move it all the way.
Okay, and why is that?
A race car accident.
Oh, okay. Well, I'm gonna make sure not to assess that joint, and just to make sure you know you don't wanna overexert yourself or hurt that joint anymore. So what I'm gonna do is check your elbow joint. Okay. Can you flex it? Sorry for the technical difficulty. Can you flex it? Extend it. Okay, flex it one more time against my resistance. And then extend it against my resistance. Okay, no cracking or crepitus noted. So I'm now going to do the same thing for your wrist. Can you flex it? Extend it? Hyperextend it? Okay, can you flex against my resistance? Go all the way down. Then extend, and then hyperextend. Okay? No cracking or crepitus noted. We'll do the same thing over here. Can you flex your elbow? And then extend your elbow? And then flex against my resistance, and then extend against my resistance. Okay, we're gonna do the same thing. Can you flip it? Extend, hyperextend. Okay, flex against my resistance, flex all the way down, then extend, and then hyperextend. Okay, no cracking or crepitus noted. And one thing I forgot to mention while doing your respiratory sounds is if you do, develop any type of respiratory illness, like, we're in the season of COVID, what I'll instruct you to do to help is do 10 big deep breaths an hour, followed by a cough. So can you breathe in, breathe out, and then cough. And that just helps, expand your lungs, because we don't expand our lungs every day with everyday breathing. And if you cough, just in case you did have mucus or any mucus buildup in your lungs, that will help expel any mucus. And if you had any mucus today, we will look at it to see if it had any odor or abnormal color. So moving on to the cardiac sounds, and we'll listen to your heart sounds. Do you have any history of cardiac problems in your family or anything? Okay, I'm gonna put the stethoscope on your chest. Is that okay? Okay. So listening on the right side in the second intercostal space, I'm gonna listen to the aortic valve. Okay, then move it over to the second intercostal space on the left side. Listen to the pulmonic. And then moving down, listening to Erb's point, to the third intercostal space. And then fourth intercostal space, listening to the tricuspid sound. And then I'm going to go to the mid-clavicular line, listening to the fifth intercostal space for the mitral sound. And the mitral sound is also where you can have your points of maximal impulse and apical pulse. But your cardiac sounds were rhythmic, S1 and S2 were present. I didn't hear any sounds from murmurs, but if I did, I'll listen to it on my bell side. And can you lay down for me? Do you have any recent stomach issues, stomach pain, any problems defecating or using the restroom? Okay. And when was your last bowel movement?
Yesterday.
Okay. And was it normal? Was it anything that you should be concerned about?
Normal.
Okay. So first thing I want to do is going to inspect the abdomen. Get it down, and I want to see that there's no distension, there's no pulsations, no lesions or anything, and there's not. So what I'm going to do is listen to your quadrant sounds to listen to your bowel sounds. Starting at the right lower quadrant, I'm listening here first because that's where bowel sounds are most active, and I'll listen here for 1 minute. Then move it over to the right upper quadrant. I'll listen for 1 minute. Then left upper quadrant, listening for 1 minute. And then right lower quadrant, listening for 1 minute. Okay, bowel sounds are active and normal. Now I'm going to do the same thing, listening on with the bell side. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And also I'm going to listen. I'm going to find the xiphoid process in the middle of the umbilicus. And this is where I will listen for an abdominal aortic aneurysm. And I don't hear anything. You go ahead and sit up. Well, actually lay it down. Sorry about that. I want to palpate. So I'm gonna do a light palpation first, and let me know if you have any discomfort. Okay, and I'm gonna do a deeper palpation. Did you have any discomfort while I was doing that? Okay, you can sit up. Okay, and now I want to note that the femoral pulse, it's like the crease where you sit down. That's your femoral pulse. Popliteal is behind the knee. And then your dorsalis pedis pulse is kind of between your big toe and the second toe, right here. And then your posterior tibialis, like in that little dip behind the ankle. That's where you'll find that pulse. Okay, so what I want to go ahead and do is check for edema in these lower extremities as well. You bring your legs out a little bit. Okay, no edema noted. No edema noted. So I'm going to check for range of motion in these areas too, in the lower extremities. Do you have any problems with these joints or anything? Okay. Can you kick your knee out and extend it? And then flex it? Okay, no cramping noted. Can you kick it? And then flex it again? Okay. Now, can you bring your foot out a little bit? Okay, point your foot down, plantar flexion, and then dorsiflexion, bring it back up, and then plantar flexion again, and then dorsiflexion again. Okay? Now, cracking or crepitus noted in the right lower extremity. So we'll do the same thing here. Can you kick your knee out, extend it, and then flex it? Okay? Extend it one more time, and then flex. Okay, no cracking or crepitus noted. Okay, can you plantar flexion and then dorsiflexion, and then plantar flexion again, and then dorsiflexion. Okay, no cracking or crepitus noted in those lower extremities as well. All right, do you have any? Do you know where you're at right now?
Mm-hmm.
Where are you?
Your house.
Do you know why you're here?
Helping with the video.
Okay, and do you know who the president is?
Nobody.
Okay, so that was just a neurological assessment. Just want to make sure that you're awake, alert, and oriented. And we can say AO times 4. You're awake, alert, and oriented at present, place, time, and orientation. And another assessment we can do is called a Glasgow Coma Scale. And that's usually for patients who are unconscious. They have a score less than 8. That means you have severe brain damage. And a score 13 to 15, that means mild to no brain damage. Can you get up for me? And can you just walk to the table and back? Okay, you sit. Okay, your gait was well. I didn't notice any problems with your balance or anything. But if I did, we could do 2 tests. A Romberg's test and a tandem walking. And Romberg's test, when you stand with your feet together, hands by your side, eyes closed, and I will have my hands on either side of your body. And I just want to like watch for any swaying or any off balance. And tandem walking is when you do heel to toe walking. It's like a field sobriety test. Okay, so you have no problems with that. And another test I want to say is the Braden scale. That's just for if you have any risk of falling or anything. And 3 ways that the test for a Braden scale is nutrition,